Thank you everyone for showing up. All right, so who is South LA Building Healthy Communities? So we're a collaborative. It's an initiative that brings together a diverse set of community partners working across different areas that address health, disparities facing the area's Black, Latinx, and immigrant populations, and also broaden the issues and narratives that help shape equity solutions. And so this next slide, this next slide shows the 17 organizations that are a part of the South LA Building Healthy Communities Collaborative and that have also worked together to develop the report titled South Central Rooted, which we'll go into detail in the next slides. So South Central Rooted report was born out of a series of conversations that were held with the South LA Building Healthy Communities organizations and grassroots leaders as we approach the 25th anniversary of the civil unrest, or the 92 civil unrest. And so as folks came together to commemorate this flashpoint in South LA's history, it also led to a discussion about, well, what's really been changed, right? What's been changed in South LA or what hasn't changed, and what is it gonna take to fully see that transformation in South LA? And so from these conversations, the South LA BHC partners articulated and refined a framework that we now call the drivers of disparity as a way of understanding the root causes and current state of inequity in South Central Los Angeles. And so South Central Rooted uses a historical analysis of each driver to demonstrate how white supremacy and specifically anti-Black racism has perpetuated inequity for Black Angelenos and has also been the foundation for the oppression of the Latinx, immigrant, and Indigenous communities in South LA and the county at large. And so the consequences of ignoring this historical analysis is, in any policy solutions that'll be addressing surface symptoms of white supremacy without eliminating its root cause. At best, and at worst, policymakers and residents resort to harmful narratives that shift the blame from institutional racism towards community or individual failure, which we know, is not really accurate. Next slide. And so it's our hope of the South LA Building Healthy Communities partners that our current political moment provides an opportunity to dismantle the legacy of anti-Black racism in Los Angeles. And we hope that this historical analysis fosters conversations and action that advances intersectional pro-Black policies that benefit BIPOC communities at large. The COVID-19 and the racial justice uprisings across the country in 2020 have put a spotlight on existing economic and health inequities and have also opened up an opportunity to push for policies that were previously not seen as feasible. The South Central Rooted report also highlights how South LA community organizations and grassroots activists have also been at the forefront of redefining what is politically possible in South LA. Next slide. And so as we mentioned, I talked about the drivers of disparity. So South Central Rooted report puts forward 4 drivers of disparity. The first of these drivers is gentrification, displacement, and homelessness, which is, as we all know, is not a new phenomenon for our communities of color, but they're actually a direct result of a long line of exclusionary housing and development policies, coupled with the loss of affordable and subsidized housing and a disappearing social safety net that disproportionately harms people of color. The second driver, poverty, disinvestment, and joblessness, speaks to the longstanding impacts stemming from the exclusion of homeownership and other wealth-building opportunities, and reinforced by the lack of equitable public infrastructure and services spending, which has resulted in entrenched poverty conditions and spatial inequality for communities like South LA. And then we have the driver number 3, policing suppression, deportation, and mass incarceration, a mouthful. Speaks to the pervasiveness of police presence, surveillance, and criminalization that are often tools of gentrification, but also the erasure of longstanding communities of color as well. And then we have our driver number 4, environmental racism, which has been enacted hand in hand with exclusionary housing policies and is also a function of where people of color are able to live, work, and play in Los Angeles. Next slide. So this is a lot to take in. And we know that today's conversation is going to be a part of that change that we're trying to see. And so the community has been saying that for a while now, but now planners, elected officials, and policymakers are starting to consider how policies across issue areas intersect and disproportionately cause harm to Black and people of color communities. And so we hope that this historical analysis fosters deeper discussion around the types of solutions that we need. Thank you. And then you can connect with us by visiting our website at southlaisthefuture.org, where you can find more information about different webinars that we've been hosting, as well as podcasts that we've been uploading as well. So yeah, feel free to check out some of our work with that site.
And definitely, if you're on Twitter and Instagram, join us. Anything you find interesting today, please share. All right. So as Jessica mentioned, this is a political moment right now. If we think of COVID-19, it hasn't just impacted the health of the community, it has impacted the well-being of our community and health in a broader term. It is about, we're dealing with issues of housing and education and digital divide and all of these things that we know are not new to today, but have been exacerbated by COVID. And we need those solutions that will address multiple things, not just one singular thing. And the American Rescue Plan starts to get at that. So today, we are excited to have Yolanda Vera, who is the Center Health Deputy for LA County 2nd District, Supervisor Holly Mitchell. And you may know she also worked as a Chief Counsel and Senior Policy Advisor to former LA County Supervisor Mark Ridley Thomas. So we're glad to have her back in this capacity in the 2nd District. And I won't through her resume, because you can see she has had a long history of fighting for health inequities and disparities in Los Angeles for a long time. Although she's only 25, so it hasn't been that long. And so I'm going to let her speak because she's got a wealth of information she's going to share with you. Please, if you have any questions, add them to the Q&A so that you don't have to hear me talk at the end, but we can hear your questions. Yolanda, take it away, please.
Great. Thank you for that nice introduction, Sonya. Always a pleasure to be working again with you. And we were commenting before people joined the call about how it's wonderful to be in this position to help Supervisor Mitchell, but then also just to see old colleagues. And it's true that the apples all fall close to the tree. So Sonya had asked if I could give a little bit of an overview of the Rescue Plan Act. And there's so much that we don't know. So what I told her is well, I can give an overview of what's going on, the internal process within the county, and then how we hope to move forward. And then perhaps when we have more details, to come back to you. And so this was an agenda here that I wanted to discuss with you today. First, it's a little bit about the act itself, and then the internal process within the county and what we are going through in order to figure out how to roll this out. A little discussion about some preliminary 2nd District priorities. A little bit about the process of trying to find common ground among the board offices as we figure out how, as a county, we can roll this out, along with input from the process in terms of how it relates to getting input from the community, and which is part of the next steps. So why don't we go ahead and go to the next slide. So the American Rescue Act, a huge, giant amount of money that was meant to provide COVID relief, and recognizing the impact that COVID had on our communities. And so it is a tremendous amount of money, $1.9 trillion, that was signed by Biden in March. And it has to be spent within a certain time period for certain purposes. And there was different buckets of money, which is kind of what confuses people. There's some money that's going directly to some of the departments for some of their COVID relief. Some of the clinics are getting a separate amount of money. Some of the hospitals are going to be getting some separate COVID relief funds. And then there's money that went to the state as a whole in California. Then there's money that went to local governments, the county and the city. And so there's lots of opportunities. The challenge is that it's one-time funds. And so we have to spend the dollars within a certain period of time. We have got to spend the money by December 31st of 2024. So that means there's a lot of challenges on what you can do in that, given those realities. And we're also waiting, and part of the reason that we don't know a lot is we've been waiting for guidance from the Department of Treasury that'll explain a little bit more about how local governments can spend the money and what we can spend it on and not spend it on. So why don't I tell you a little bit first about the Act, and then we'll talk a little bit about what it means for our county and for our community. So as I said, 1.9 trillion. Among the things that it lays out is, it's 622 pages. If you ever wanted to read it, it's HR 1319. But it's funding for COVID testing, treatment, and vaccines. There's expanded and extended unemployment benefits. There's a lot of child tax credits that are going to be in there, as well as earned income tax credits. And this becomes important as a community because our ability to get some of these benefits depends on our community knowing about it and getting help accessing it. Food assistance and WIC benefits are an example of that. For expanded health coverage, there's some things that they're doing in Medicaid to enhance some of our ability to draw down Medicaid. They're also subsidizing some of the insurance coverage as well, too, that we have from the Affordable Care Act. There's going to be increased housing assistance. The fiscal aid to the states, which is something that I'll say a tiny bit about. I think California is scheduled to get 26 billion with a B, like boy, dollars in there. There's K-12 funding, which is wonderful to help our kids go back to school. And then there's some emergency funds for families facing hardship. So it's a big package. It's a big bill. And among the things when I think of community groups that are critical, because we saw this with the first round of funding that went to localities, is if you know how to apply, you understand how to get the benefits, you'll get it. And I know sometimes with our communities that we serve, because of the digital divide, because of language challenges, people need a little bit of extra help. So that's something that I don't, we've been and hope to talk to funders about is how can we help folks get help to gain the benefits that they're supposed to get once they get clarified. So let's go to the next slide. So what does that mean for LA County? Well, we know that the city of LA City is getting $1.3 billion. And some of our other cities are also getting money as well too. LA County itself, our county, is getting $1.9 billion. And that's a lot of money, but again, it's one-time money. And we can only use it for specific purposes. We can use it to respond to the public health emergency or the negative economic impacts of the public emergency. We can support essential workers. We can backfill our budgets for any loss in revenue as a result of the pandemic. Or we could do like some broad infrastructure like water and sewage. That's vague, and that's why this guidance from the Department of Treasury is so important to understand how we spend it. Let's go to the next slide. So when this first was announced and the bill was first released, this is the timeline that the CEO presented that we thought we were going to follow to figure out how the funds got expended. That there were going to be some proposals that all the departments submitted to the CEO's office. And in LA County, we've got 36 different departments that they were going to submit proposals. The CEO was going to assess the proposals by April 13th. The CEO is then going to present a proposed spending plan to us, the Board of Supervisors, on April 30th. And then they were going to spend this time period vetting that proposal with us. And then there was going to be some further give and take from the board offices. And then finally, May 18, which is next Tuesday, the board was going to approve the plan. If you've been following the board, you know that it's not on the agenda because this timeline hasn't happened. We still don't have, I can tell you what's happened. Let's go to the next slide. What's happened is that the departments submitted proposals. All the departments did. The board conveyed what their priorities were. And as in the case of Supervisor Mitchell, and some of you may have attended, she had a community meeting where she laid out, here's some of the things we're initially thinking of. It was a ridiculous timeline. Here's some of the things we were initially thinking of. What are your thoughts? So she came up with some of what her priorities were, conveyed that to the CEO. We're still there where it says we are here. We still don't have the recommendations from the CEO. We still haven't started our board review process. It still hasn't been shared in detail with community groups like you to go to the board for final approval. So we're early on, and in some ways I feel like maybe it's a good thing because then we can come back to you with, hey, we understand now what's in there, and here's some opportunities both for feedback and adjustments and for opportunity for hearing your voice on what you think we should do. So next slide, please. So when the CEO initially came to the board and said, okay, we want to hear your proposals, what the CEO also said is, we want to break, and we think our spending for this $1.9 billion should be broken into these four basic categories. Health, which is how do we sustain our COVID response, including all the health-related impacts of the pandemic. Economic recovery, how do we help our small businesses, entrepreneurial businesses recover from the impact of this COVID? Equity investments, so how can we be better than before? How can we address some of the inequities that we all know are embedded in our systems? And then sustainability and preparedness. How can we they're the CEO, it's their job. They're going to be thinking about backfilling and looking at our budget, but how can we support the county's fiscal future going forward? So that was the breakdown in the categories that the CEO proposed when they talked to the board offices. So what we did is we then talked internally, and we had a community meeting with some feedback in a short timeline. And we started to focus on some of the initial second district priorities. Next slide, please. So I'm going to, in these next slides, talk a little bit about what some of the second district initial thinking was on the priorities, and we conveyed it to the CEO's office. One, basically, we needed to control outbreak management. What we learned, and I especially saw this as a CEO over at the MLK Outpatient Center, that this pandemic was so brutal on our community. We had a testing site that we did in partnership with CDU that was seeing 1,000 people a day, and they were just standing in line, cars going, around the block, and people would be in line 4 a.m. to get tested. And so we clearly need to build our systems for outbreak management. And so that's one of the proposals. Public health enforcement generally, we also saw some lags that we needed to do more with regards to some public health, and just to make sure our places are safe, our workplaces are safe. We saw a number of situations where many of our immigrant workers in particular were put in situations that weren't safe, and then they would come to us in the clinic because they were sick. We wanted to really invest in violence prevention in particular. And this relates to not only unreported incidents of domestic violence between partners, but that we've seen an increase in violence among our youth. And I think partly it's just people are getting frustrated and the economy is bad. And so we really wanted to do a huge, significant investment in those types of activities. And then we wanted to do more around, really look at diversion-related issues in homeless housing. On diversion, the Office of Diversion and Reentry, they focus on getting folks out safely from incarceration and then preventing them from going in the first place. We've never been successful at identifying an ongoing funding stream for them. The supervisor, in fact, has a motion this coming Tuesday on diversion that I can share with you. But it's anything we can get from the federal and state government, we want to put towards our justice-related populations to help them get on solid ground. Then obviously on housing, we had so many patients presenting at the clinic who suddenly had housing issues. They couldn't keep up with the rent. So really wanted to do an investment there. Next slide, please. The other priorities that we saw as well was doing more work on justice defense related work. And this could include everything from legal defense work to bolstering up of our public defender's office. And there was just a general number of proposals that we did there. And empowering our communities on entrepreneurship. There was a sense, and we were hearing from people that people need support, especially small businesses, on how they can become sustainable small businesses. So that included a lot of ideas, concepts around micro-employer grants. And there's, I don't know why the Arts Relief Fund is in this category, but there it is. We wanted to do some work around arts relief that frankly should go in the health one because we wanted to do everything around therapeutic mental health relief. So those are some of the general things that, and I can talk more about in detail about the economic recovery ideas that we had. So next slide. There was other things was just figuring out how to get LA County back to work. There was a lot of training that needs to be done and then just making people available and aware of some of the jobs that might be out there. There was employer-driven training, and then obviously childcare. And given Supervisor Mitchell's background, childcare was going to be a huge priority for her to ensure that people have the support to get back to work. Next slide. Equity investments, and this is to try to address many of the inequities that existed. Also on this coming Tuesday's board agenda, you might have seen mention of it in the LA Times. The supervisor introduced a motion on a guaranteed basic income program, essentially using some of these funds, and it would target, it would be a pilot project. The goal is to give at least $1,000 a month to a targeted individual. It could be either someone, we're having the CEO design the program. In our populations we were looking at was domestic violence, someone recently incarcerated, or I believe someone who was homeless, but I might be wrong on that one. So, but anyway, there's three categories. And so it's an initial coming up with a plan. And so that's part of the idea, using this one-time seed money to do that, so we can do an effort similar to what Compton has done and some of the other cities that are considering the same. We really wanted to continue to support our promotoras and outreach workers. I'm a big fan of those. And then the work at the community clinic, at the outpatient center, really confirmed the importance of the promotoras and how much of a difference they have made in the lives of our patients, especially as a bridge to understanding the healthcare system. And I also think they're going to have an important role on understanding this Rescue Act and how people can get relief. Here's the homelessness and housing, a huge amount of money potentially for homelessness and housing. I know the departments of health services both their Housing for Health program and the Office of Diversion and Reentry both had big proposals and ideas around dollars that could help us with our housing and homeless crisis. And then we wanted to do more work on minor savings accounts and baby bonds. So minor savings accounts are essentially something which is you tell a low-income family, listen, we're going to put X amount of money for baby Yolanda, and this is her college education fund. And there's incredible research that shows that when you do that, just the expectation that this pot of money is going to be for their education down the line, it's shown to be really successful. And then the family contributing, other people contributing, and the child eventually going on to use the account. So that was one of the other concepts. Next slide. These are some infrastructure, and I am not an expert on infrastructure, but there were some thoughts and proposals to get more on the rail to rail, and there was just a recent work that we're really making progress on the Crenshaw line. So finally, I think there's finally going to be a good line that'll really extend through our community and help people get to work, get to home, and get to their healthcare. We wanted to invest more in the Manchester, Vermont area to really boost that particular area commercially. In this category, I'd also put this huge category of digital divide. And this is an interesting thing because a lot of people say we have to bridge the digital divide, but it's really hard to do. And it means a lot of different things. When I was at the clinic, what we were noticing is that our local residents were having a hard time making an appointment to get a test. And we found when I would walk the line that a lot of the cars that were coming in were really nice cars and clearly just not people who lived in the community. So we decided in that case just to open up the testing to everybody. You didn't have need an appointment, you just come in. And that type of approach, we need to figure out how to make sure that our lower income residents who may not have that savviness, whether it's to get a vaccine, whether it's to get a test, regardless of what it is, that they either are given the tools and the training to approach this now digitized age, or else we make accommodations so that they're not totally left behind. And then obviously the food incentives, there's a lot of folks who needed food. They show up, I'm sure, at your places at food drives, and folks who are hungry who are just barely making it. So we really wanted to maximize what we can get to give those benefits. Next slide. So in a broad scope, those were some of the things that the second district was telling the CEO, hey, take a look at some of those things. And the next process is the CEO then heard from all the board offices, and they have this $1.9 billion package that we're going to need to spend by December 31st, 2024. And they need to come up with a proposal that finds common ground that would be supported by a majority of the board offices. And so when we talked to the other board offices, there were some common themes that seemed to float up that at least one other board office would mention. And in some of those are around home visitation. Probably not a coincidence that you see a motion on Tuesday to look at how we can support home visitation for at-risk pregnant moms in particular, to make sure that they have the support and their new infant has the support to keep and stay safe and healthy. Many board offices mention the issue of domestic violence. There seemed to be some support around domestic violence. Mental health support and acknowledgement that COVID really did a number on all of us, and a lot of us experienced a lot of stress and anxiety, in particular concern for students. Also a concern for community-based healthcare. How can we help our community groups provide culturally sensitive mental health? There was, let's see, there was common language around diversion and housing support. There was at least 3 offices that expressed support for guaranteed basic income of some type. Mortgage relief, helping homeowners keep their homes. So that was seemed to be a common frame. Community land trust was mentioned multiple times. Support for low-income women entrepreneurs. Entrepreneurs was something that was mentioned. The digital divide, whatever that means, but that was a common theme. Landlord and tenant relief, eviction defense was something. Project Home Key and food distribution. Those were, when we talked to the board offices, it seemed like those were common themes. But we're waiting for the CEO to come back with, okay, this is what we're going to propose. Next slide, please. Among the things that is incredibly important for Supervisor Mitchell is it's important to find the common ground, but it's really critical that we apply equity when it comes to distributing these funds, because we know what communities were the hardest hit when it came to COVID, and that's what sparked this. I'm going to show you a slide in a moment, but the 2nd District accounted for at least 24% of the cumulative number of COVID cases in the county, and at least a quarter of the deaths. So the argument is that you need to ensure that the dollars aren't divided by 5 and that they really proportionately go to the communities that need the most help. So next slide, please. I think this might be the. So if you were to do, for example, a data breakdown that just looks at, for example, poverty level, incidence of COVID, and unemployment rates, you could see the patterns in the densest impact areas. And it was, in that case, if you use those as indicators, we don't know what indicators the CEO is going to propose using, but it would be, in the strip around the South LA area, portions of Supervisor Solis's district, and then also portions of the Burgers district. It's not to say the other districts weren't hit. It's not to say that they shouldn't get relief, but this lens is really, really critical to the supervisor. So the next steps, what's next? We're gonna get the proposal from the CEO, and then there's going to be, I'm presuming, I'll be honest, we're not sure what's gonna happen next. We're gonna get the proposal from the CEO. There's gonna be then presumably some brokering and response from the board offices. We believe the board offices are gonna hold off filing motions on rolling out large things, but we don't know what the implementation is gonna be. But what I commit to do is that as this gets clearer in terms of what LA County is thinking of doing and what the opportunities are, both before it occurs, we will let you know and let you know about when the board is considering items and when there's opportunities to weigh in. But really, really also want to be sure that we let you know that whatever the decision is, we get the word out to you and your families and clients so that they can claim the benefits that are going to be made available to them at least in the county's implementation plan. There are $1.9 billion that are coming. But if you looked at all the ideas that the board offered, it's probably $3 billion in ideas. So somewhere, somehow, there's going to be some compromising happening, and your voice is very important to the supervisor. So why don't I just stop there and see what their questions are, and I'll do my best to answer what I can.
Thank you so much, Yolanda, for that. We really appreciate it. And as a reminder, please, if you have any questions, throw them into the Q&A so we can make sure we get Yolanda's responses while she's here. And thank you for committing to wanting to share as things come out. And I'll ask if we could stop the share screen. And before we jump into other questions, I have a question that concerns me a bit. I presumed that the reason there was that May 18th deadline was because these dollars might be included in the county budget. So with this delay, does that impact anything? Or will there be a rush to try to get everything approved or the budget is approved?
No, not as part of the overall budget process, because that was asked. So the monies will be received, but they're not going to be, they're one-time funds, and the county CO's figured out a way so that they're not going to affect the overall county budget process. But you raise a really good question on that, Sonya. And so what I can do, and I have my little pad of paper that I'm going to be taking notes and taking it back to our budget team in particular was very curious about your questions on that. But no, it is going to come in. And I think, the deadline on the spending is a thing that we're most concerned about. And it's also wanted to be sure that as much of the money as possible goes out to the community quickly, because many of these things that we're talking about are best done by CBOs. And so trying to figure out how that works so that the money can go out as quickly. I know this is an issue that came up on Measure H as well too, is ensuring that the money goes out the door. And who is going to be the entity it's going to do that? It may be the individual departments, or it may be more centralized.
Thank you. Another question, we were glad, I've heard the supervisor talk many times about it can't be the normal divide by 5. And I'm glad to hear that, that she's pushing to make sure that the second district and other needed places get their equitable share. What kind of sense are you getting from other board offices or the CO's office that there will be that equitable distribution of funds and not just an equal distribution?
I do think there has been some support for the concept of equity from the CEO, and certainly some of the board offices have expressed their support for the concept. There was a motion around business that the first district did, and I think we might have co-authored, that mentioned the importance of equity. But Sonya, you and I've worked together long enough to know it all depends on what does that actually mean, and what are the factors that you're going to consider. The 3 that I shared, which seemed basic and logical, which is if you've got a relief act that's meant to affect the harmful effects of COVID, including the economic effects, well, then you look at income, you look at unemployment, and you look at COVID rates. But no one has yet adopted that as a formula. We've adopted formulas when we've done other distribution. For example, Measure H had a formula based on the homeless count. There was clinic funding, the community clinic funding. There also was a formula there that was based on factors. So we'll see how it goes, and it might be an opportunity for this group in particular to weigh in. I think what we would be nervous about is having it left to each department to figure out how to do it. So So the board hasn't tackled it yet in terms of what does equity actually mean in the case of these dollars.
So you raise a good point in terms of like the departments, and could you explain a little bit more about sort of how will these funds really be disseminated? So we understand that there will be dollars distributed to the districts, but will like the supervisor's office have a pot of money that you guys will disseminate, or will it still go to the department? Got it.
I wish we did that. Would be lovely. It's unclear. We're waiting for the CEO's recommendation. Because they're one-time funds, so you really can't create a brand new program with one-time funds. Mm-hmm. It is likely that the CEO is going to recommend that pockets of money go to the departments and they distribute it through either an existing program or a program that we know they have the resources to create. But this is where the challenge is, because how do you make sure? I mean, we have wonderful departments, amazing leaders, but it's not a secret that the county has high overhead, and especially when you want relief to go into the community. Frankly, it was the community clinics that just hit home runs out of the park on the vaccine effort. And so it's that nimbleness in getting it out. But I know there have been certain board offices that have all expressed that concern, but we haven't seen the proposal yet from the CEO. Yeah. So there is going to be, I'm presuming, some of the breakdown will mean going to a department to support a program. But some of these departments we know already have a partnership with CEOs, like ODR, for example. Mm-hmm. We know if they get money, well, they're already partnering with groups that do diversion work. So it would be passed through. But that's a wait and see. And when we have information and get information, we'd be happy to share.
Okay. Well, I was glad to see. And in that respect, it's good that it's going to, support and strengthen our existing infrastructure. And it looks like, your office, as well as the CEO's office, has really thought about how do you not just waste this moment and waste this funding for just a one-time thing, but really use it to think about our infrastructure. We know that, unfortunately, this is not going to be the last pandemic we will ever see, or the last drain on our health system and all of our systems. So is that a similar sort of trend with the other supervisors, that's really looking at how do we use these dollars for now, but to build us up for the future as well?
Yeah, I think with the CEO, obviously, is going to want to spend, we don't know how much, a chunk of this money to backfill. There was a number of expenses that the county had as a result of the COVID. Everything from construction projects got delayed, setting up the vaccine and testing sites that we did, hugely expensive. So I know they're going to take a portion of it. I do think there's unanimity among the board to make sure that the investments are made in the system. Because I agree with you, it's going to happen again, Sonya. So don't throw away your masks yet. I'm just going to put them and tuck them aside. It's going to happen again. But I think it's going to take a little bit of a push to remember where it was hit the hardest in the communities that need the deeper investment in the infrastructure. You have wonderful champions like Dr. Ferrer, who was constantly reminding the board about that. And I know they're going to be getting separate funding as a Department of Public Health, and they've made it clear that that's one of their priorities is ensuring that they address those equity issues in the dollars they're going to get.
Thank you. One of the questions that we have, as you mentioned at the beginning of your presentation, there's different ways this money is coming into the community. And we know that there's supposed to be money going straight to organizations that support with rental assistance, utility assistance, and then funding that's supposed to be going to our educational system, our school systems. Do you have any, and if you can't respond to this, we understand, but do you have a sense of when those dollars are supposed to start flowing into the community?
No, and I would say that there's a fourth bucket or an additional bucket. You might have said four things. And that is money that is out there waiting for people to claim. And so whether it's additional subsidies for health insurance, or whether it's the child tax credits, whether it's enhanced food stamp or WIC benefits. And it's going to take, once we understand what those are, it's just educating our community and being available to them so that they can claim the benefits. So don't know, it's going to be soon, but I don't know when to tell you green light, go, here's how you go, here's where you apply, but we really are committed to want to get that out to you guys.
So along those lines, is there or will there be some funding dedicated to, communities, CBOs, outreach workers to help get the word out about all of these different pots of money? I worry that if we don't show how important it is for people for these funds around the additional food assistance and all of that, that we can't argue later that we need to continue to keep them and not drop them.
I know that in the proposals from the board, there were a few offices that suggested that and proposed that. The CO hasn't come back yet, Sonya, but I mean, one of the things that certainly our office would be supportive of is any partnership with local philanthropy to make sure that happens, because, and we've seen that in the past where philanthropy will wonderfully make like a grant writer available to help people apply for a funding opportunity. And there's just, I think there'd be an openness to that. And if there's anything that we could do to help support that, please let us know. Be happy to join any calls or help write any letters, because I agree that it's not going to happen unless there's some good folks in the community helping people understand the benefits.
I am hopeful that, there are a lot of good policies that have passed, and I'm hopeful that we can actually keep them and we don't have to, and I know a lot of them expire in December or sometime shortly thereafter. So hopefully we keep those in line. And speaking of which,
just a story, Sonya, I remember years and years ago, there was this cash assistance program for immigrants that was created. I'm probably dating myself. And I remember in that case, in the Asian community, they had such a strong sense of like helping their community. And we mentioned it to some community advocates, and they went gangbusters, so that when we looked at who was claiming these CAPI benefits, it was these helpers that were helping their community. So yeah, Philly, I appreciate your question.
One of our questions from the audience is, it feels like this is a sort of a top to bottom sort of approach. So where is the grassroots push? Like how, I mean, we know you're in government right now, but Yolanda, we know your roots are in public health advocacy. So give us some words of wisdom. Where do we push?
I tell you, I wish I could disagree with you. I will disagree with you on behalf of my boss, that my boss I know
right.
Wants us to reach out and wants us to tell you about these opportunities. And you are absolutely right that this is it is a top down, and part of it is timing, part of it is habit, and just know that from Supervisor Mitchell's perspective, it's so critical that she get your feedback. It's tough to turn corners quickly on some of these things, especially as you're trying to kind of figure out board votes and everything else. But know that, this presentation, my offer to come back, it's really, her telling us, get out there and tell folks as much as we can about this. So I wish I could tell you more.
Yeah, yeah, I know, and I know that one of the questions is about how is feedback solicited, but I know that at least Supervisor Mitchell did have some sessions in the community, and I believe you are always open to receiving. I think, isn't there like a comment page on your website or a way for people to submit?
Correct. There's a comment page on the website always. And it's also, I think it's hard to comment without knowing what the target is, because 622 pages, I mean, it's a little hard to figure that out. But I do think as things roll out more, there will be opportunities as we look at the various departments. So what I would suggest is when we learn more what the proposal is and the amount of money that the CEO is suggesting we have available for the community and for our residential services, that we come back and then kind of hear, okay, what are the elements of that might be important? It might be something like, wait a second, Yolanda, the CBOs in South LA, they have no access to applying for those grants that are administered by that department. And then it's, okay, we give you a training, we talk to the department head, we get you guys so that you can compete if there's a competitive grant process. It could be something where money goes to a particular department and they're allocating in a way that doesn't seem to be equity-based. And then we engage in that way. You let me know or the respective deputy know, and we engage in that way. I mean, our main goal is just making sure people know about it, so that they can, they can weigh in and then help us when the programs get designed, implemented, that we can roll it out in a way that benefits the community.
No, that's great. And I think if I could paraphrase, and hopefully I don't misparaphrase one of the last comments on the Q&A, is basically that we have a lot of community groups we have a lot of organizations in the community, many of which are not already connected through the various county departments, and often get overlooked because they don't have the infrastructure, or maybe aren't seen as the right organization because they don't typically do this type of training and whatnot. But if we were able to support them, train them, help get them, pay them to build up their infrastructure, they really connect to and even those hard to reach communities, populations that some of our other more established organizations don't always get down to.
Yeah, I can't agree with you more. I've worked in nonprofits, and getting a county grant is so much work and so hard. The contracts are very thick. They have a lot of requirements in them. They require a lot of paperwork, which seems, burdensome. And so we periodically, actually, we're just getting a training, for example, coming up with Department of Mental Health on what does it take to get a contract with DMH. And so we're going to talk to them in the hopes that we can then pass it on to community groups who've expressed an interest on getting contracts. That's the type of thing that, we'd love to help with in partnership with philanthropy, because the application requirements across the departments are all different. DMH's legal entity requirements are like one thing. The substance abuse prevention control are another, and so everything's a little bit different, and we recognize that. So, for example, on the Office of Diversion and Reentry, there's been a push. Oh, everybody should be a Medicaid provider. Then we could draw down federal funds, but that's impossible for our smaller, CBOs. Yeah. So it's a huge challenge. We've talked about it internally, and maybe if we could identify what those opportunities are and those focused departments that hey, this is an opportunity, let's focus on this department, let's do that. And once we get a better sense of which particular departments, there seems to be a common thread.
I appreciate that. I know this is not where people's heads are sometimes, but I'm really big on how do we streamline our processes and figure out how to make sure that things are easier for people to get in and stay in, is hard for people to get in and easy for people to drop out. So we are at time. I want to thank, on behalf of the South LA Building Healthy Communities, I want to thank you so much for taking time to talk to us and your willingness to come back as we learn more. I'm hoping we can also share your slides. I know people were really interested in them. This is, as everybody knows, this is being recorded, so you'll be able to look at it later and hopefully digest it a bit more. For those of you that have not checked us out, please go to Southlaisthefuture.org. You will see other presentations. We have a podcast where you'll see the report and other information. We continue this series talking about COVID-related impacts, not just on health, but on all the drivers of disparity. So we hope you'll join us again. Thank you again, Yolanda, and thank you to everybody who helped us put this together. Have a good rest of your evening.